That's great. Well, thank you very much. I'm very happy to be able to join you and to be able to give you some insights into our approach at the Federal Ministry for Economic Cooperation and Development, because the agenda that you have on your conference is very important, although I regret that I can join you only online. But it's great to be online. Well, it was already said that COVID-19 has shown us once more that we are not really well prepared or sufficiently prepared regarding pandemic outbreaks at the global level. And that, of course, is something that we are focusing on. Our development goal in the field of health is to reach the universal health coverage, UHC, that was mentioned already, and that means that everyone, regardless of their financial means, have access to top quality universal health services. And health services do not only cover diseases, but also prevention, promotion of health, rehabilitation measures, and palliative care. Therefore, the objective of universal health coverage is to promote health, to cover good health, and to do rehab. Well, half of the world population still has no access to essential health services. Up to 88% of people in underdeveloped countries have no access to general health services. That needs to be changed by improving the reach, the structures, and the infrastructure for general health services. And it was already shown in the little video clip that people with disabilities are particularly affected and vulnerable and have much worse access to the general health services. Half of the 1 billion people with disabilities worldwide cannot afford healthcare services when compared with people without disabilities. And people with disabilities have the same rights and needs regarding universal health coverage as everybody else. And as a result of their disabilities, they also need specific care. A number of social, economic, and systems barriers hinders their access to health care and information considerably. This includes inadequate conditions of facilities, a lack of relevant health services, insufficient skills, or negative attitudes of the health professionals, stigmatization, as well as indirect costs or discrimination. The existing inequalities, and that again has already been said repeatedly today, are reinforced by the COVID-19 crisis. People with disabilities are very often vulnerable groups, members of vulnerable groups, and have little access to hygiene information or sanitation information. The people with disabilities are the last minority group, and therefore, in order to meet the universal health coverage at the global level, we need to include them in a stronger manner. In all our areas of activity, we always have to focus on these people of vulnerable groups in order to offset and fight against inequalities in universal health coverage worldwide. Our ministry has come up with a reform concept. It's called NZ 2030, in order to make the cooperation more strategic, more efficient, and more sustainable. Health is given a priority in this scope, and unlike the initial planning, we do not want to only work in that topic in a multilateral manner, but we also want to strengthen bilateral activities, health, safety, population development, family planning, HIV, AIDS, tuberculosis, malaria, and vaccination prevention play a particular role here. Here we focus on the least developed countries with very weak health systems and lacks of capacities in the health sector in order to prevent the outbreaks of pandemics or to respond to outbreaks successfully. Inclusion of people with disabilities is given particular priority in the scope of that BMZ 2030 reform process. Together with the topic of gender and human rights, inclusion is one of the quality features of the German development cooperation. That means that this is a sort of quality label which will be used in all measures regarding German development cooperation consideration, no matter what sector they are focused on, and should be taken into consideration. The BMZ also promotes a number of projects in the field of health cooperation that promote health. For example, the program for in Cambodia and a program in Guinea. We stand for a health sector that, in view of COVID-19, should be even strengthened further. The cross-sectoral strategy that was published in 2019 that looks at the development cooperation forms the frame for inclusion also in the health sector. For an improved access to health services for people with disabilities, it is absolutely crucial that national and international laws, strategies and plans on health provision are in line with the CRPD and meet the specific needs of these people with disabilities. And the costs for health services for people with disabilities need to be lowered. Accessibility to health services as well as to health information is also an essential factor. Health professionals should be trained and should not fall victim to discriminatory or attitudinal barriers. It is also important to use digital solutions that people with disabilities benefit from. And last but not least, in a cross-sectoral approach, it is important that the slogan of nothing about us without us is met. Representatives of DPOs always need to be included into measures that are defined because they are the experts for their own matters. Mr. Dussel already outlined it in his little speech. Global challenges such as COVID-19 require global answers, responses. In order to find global solutions, the BMZ at the beginning of the pandemic has launched a Corona emergency program amounting to 1 billion euros. An additional 3 billion have also been included into the budget in order to offset the direct and indirect consequences of the pandemic in the economic field, but also in the social and health field. With our measures in the scope of this emergency program, we support in particular partner countries in Africa to keep up their essential and universal health services. Health institutions and care centers often fall victim to the pandemic. It's been seen that the personal protective equipment is not always sufficiently available, and the pandemic has shown us that no country every country can fall victim to a pandemic. Every country is affected, but those countries that have universal health coverage can deal with the pandemic more easily. They can respond in a much better manner. The cooperation includes also good governance in our partner countries as well as good regulation, because we do need to see the health system as a whole and work in order to enable a just and fair health coverage. And good health is also an engine for sustainable economic and social development in those countries. And we know that although COVID-19 has has confronted the world with lots of challenges, it is the health service that is in the center of our activities and is also a response to crises. Thank you very much for your time.